There are many ways to recharge energy. You may take breaks during the day, exercise, or relax. But the most significant way to recharge is with a good night of sleep. How much sleep do you get every night? How do you feel when you wake up in the morning? Both the quantity and the quality of your sleep have a significant impact on your health. When you're asleep, your body and your mind have a chance to rest and rejuvenate. Getting 7 to 8 hours of quality sleep can positively impact your mental and physical health and your quality of life. People who get 7 to 8 hours of sleep have a lower risk of being overweight, having high blood pressure, diabetes, cholesterol problems, stroke, and heart attacks. Evidence shows there's also a link between poor sleep and having suicidal thoughts. Most of us have experienced difficulty getting a good night's rest at some point, and it happens for a variety of reasons. You may be working too much or overloading your days with activities. You may feel stress, worry, anxiety, or have depression that keeps you up, staring at the ceiling. You may just not feel tired or be dealing with pain or illness. Or maybe falling asleep isn't a problem, but you wake up feeling tired or groggy due to the quality of your sleep. Good rest can be disrupted by allergies, difficulty breathing, or other factors in your environment. Take a moment and think about how you're sleeping. What's your evening routine? Are there any factors preventing you from getting good rest? Do you wake up rested and restored or tired and depleted? Are there times when you've had better sleep than others? What factors contributed to the quality of your sleep? What do you think made the difference? There are many simple ways you may try to improve your rest. Consider trying a few things that have worked for others, such as limiting caffeine, alcohol, or nicotine several hours before bed. Removing electronic devices such as TVs and cell phones from the bedside, or avoiding lengthy naps. Some people find practicing mind and body or breathing techniques at night help them unplug their thoughts for more restorative sleep. Some find that increased physical activity helps. Other factors to pay attention to include regulating temperature, light, sounds, sleep schedules, and monitoring food and drink that impact sleep. There are also therapies offered by the VA that you might try, such as cognitive behavioral therapy for insomnia. Making improvements to your sleeping habits is the first step to recharge. But remember, it's not the only way. It's important to take breaks and re-energize throughout the day too. People who do not take breaks from sitting during the day are at a much higher risk for health concerns. What might you consider improving about your sleeping or recharging habits? What results would you like to see? What activities energize you or make you feel most refreshed? Identify one thing that you might want to improve about your current sleep habits or surroundings to help you recharge. Or identify something that you've already done that has helped and consider adding something new. What benefit do you want to see from improving your sleep?